A transient ischemic attack, often called a TIA or a mini-stroke, is fundamentally misunderstood. Many people treat it as a gentle warning that something might happen in the future. In reality, it is a definitive signal that a vascular crisis has already occurred in the brain, and a massive, disabling stroke is highly likely to follow. The only unknown factor is the exact hour it will strike. Data from the American Stroke Association reveals that up to 15% of individuals who experience a TIA will suffer a full-scale stroke within 3 months. Crucially, the danger peaks within the first 48 hours. During this 2-day window, roughly 10% of patients will face a major stroke if the underlying blocked or diseased blood vessel is not immediately identified and treated. The danger of silent symptoms. Large-scale community research, including the Cognitive Function and Aging Study, which tracked nearly 12,000 seniors over the age of 65, uncovered a troubling reality. About 12.7% of older adults reported experiencing at least one transient neurological symptom. However, official hospital diagnosis rates for TIAs are drastically lower. This massive gap proves that a vast number of mini-strokes occur in our communities, but are completely overlooked, ignored, or brushed off as mere fatigue. The gender gap in stroke recognition. This breakdown in recognition is uniquely dangerous for senior women. Clinical data from major health systems highlights a critical gender disparity. When women experience a TIA, they are far more likely to present with generalized, non-focal symptoms. Instead of the classic signs like a drooping face or sudden arm paralysis, older women frequently experience sudden weakness, acute confusion, or rapid memory lapses. Because these symptoms fall entirely outside the traditional F.A.S.T acronym, face, arms, speech, time, public awareness fails them. Emergency triage systems and family members simply don't recognize these non-focal signs as an active cerebral emergency. Today, we will uncover all 7 signs, both the classic focal deficits and the 3 hidden non-focal signs that are routinely dismissed. Important note: this deep dive is for educational purposes only. Every single symptom on this list represents an active medical crisis. If you or a loved one experiences any of these signs, call emergency services immediately. Do not wait to see if the symptom fades, do not attempt to drive to the clinic yourself, and never postpone an evaluation just because the symptom has resolved. The temporary clearing of a symptom does not mean the underlying vascular emergency has passed. The 7 signs you cannot ignore. Sign 7. Sudden monocular vision loss, amaurosis fugax. Imagine a rapid, unexplained darkening, severe blurring, or a total blackout of sight affecting just one single eye. It hits without warning, persists for a few seconds or minutes, and then clears out entirely, leaving your vision perfectly normal. Seniors often describe this terrifying moment as a dark curtain or a heavy gray shadow descending over their field of vision. In clinical neurology, this specific pattern of temporary one-sided blindness is known as amaurosis fugax, and it is one of the most specific indicators of an impending stroke available. Data shows that unilateral weakness, combined with amaurosis fugax, carries some of the highest odds ratios for confirming a true TIA. The mechanism. What is actually happening inside? A minuscule blood clot, a fragment of cholesterol plaque from a diseased carotid artery, or a clump of platelets travels up into the ophthalmic artery, the very first major branch feeding the retina. It temporarily chokes off the blood supply. The retina starves, causing vision to plunge. Within moments, the body's natural defenses dissolve or shift the clot, and sight returns. But make no mistake, the damaged carotid artery or the erratic heart rhythm that launched that clot is still highly active and dangerous. The 2-second self-test. If your vision suddenly distorts, immediately cover one eye, then the other. If the blindness or blurring is strictly confined to one eye and disappears when that eye is covered, you are dealing with a monocular event. This points directly to a localized vascular blockage in that specific eye's supply line, rather than a bilateral issue in the brain's occipital lobe. A sudden visual deficit in a senior over 60 is a same-day emergency room visit, not an eye appointment for next month. Delaying the ultrasound, heart monitoring, and brain MRI required to catch this can cost you an 80% reduction in stroke risk that immediate treatment provides. Sign 6. Abrupt speech disruption and word-finding failure. This sign involves a sudden, terrifying inability to verbalize thoughts that are perfectly clear in your mind. Words may come out heavily slurred, garbled, or completely distorted. Alternatively, a person might suddenly lose the ability to comprehend spoken language entirely. They can hear the sound of your voice perfectly clear, but the words sound like an alien language. The mechanism. Language processing is dictated by two highly specialized structures in the left hemisphere of the brain, Broca's area and Wernicke's area. Both are fed by a critical blood vessel called the middle cerebral artery. When a microclot briefly cuts off oxygen to these zones, language completely breaks down. During the event, it is clinically impossible to tell the difference between this temporary TIA and a permanent, devastating stroke. For family members, the key pattern to watch for is a sudden speech glitch that occurs in the middle of a perfectly normal conversation, lasts for a few distinct minutes, and then vanishes. Even if normal speech returns within 60 seconds, the underlying vascular threat remains identical to a speech deficit that leaves a patient permanently paralyzed in an emergency room. The only difference is that the person whose symptoms resolved has a rapidly closing window of time to seek help before the big stroke lands. Sign 5. Unilateral facial drooping, or asymmetry. This is the classic sudden loss of muscle control on one side of the face. It can manifest as a sudden numbness, a heavy sensation, an inability to lift one eyebrow, or a highly visible droop at the corner of the mouth, making a smile look completely lopsided. The mechanism. The motor cortex in the brain controls facial expressions via descending nerve fibers. Because these fibers cross over, a temporary lack of blood flow in the middle cerebral artery of one hemisphere will instantly cause weakness on the opposite side of the face. The bedside check. If you suspect something is wrong, immediately ask the person to show their teeth in a wide smile and raise both eyebrows simultaneously. A positive warning sign is if one side of the mouth fails to track upward or one eyebrow remains frozen. If this asymmetry is brand new, it is an active TIA until proven otherwise, even if the face looks completely normal again by the time paramedics arrive. Sign 4. Sudden numbness, tingling, or weakness in one arm. This sign can present as a sudden, unexplained pins and needles sensation in one hand or arm that has nothing to do with sleeping in an awkward position. It can also feel like an abrupt weight or unreliability in the limb, or a strange, distinct crawling or stinging sensation passing along the forearm without any physical contact. The mechanism. The area of the brain's cortex responsible for processing hand sensations is disproportionately large and intricate compared to the physical size of our hands. Because of this dense neurological mapping, even a microscopic, highly localized restriction of blood flow in the sensory cortex will trigger a very noticeable and dramatic sensory disturbance in the hand and fingers. The arm drift test. Have the person extend both arms straight out in front of them at shoulder height with their palms facing up, and then tell them to close their eyes for 10 seconds. If one arm begins to involuntarily drift downward or rotate inward while the other stays put, you are witnessing asymmetric motor weakness caused by a lack of oxygen in the opposite hemisphere of the brain. Unlike chronic arm weakness caused by a pinched nerve in the neck or an old shoulder injury, which lingers for weeks and fluctuates with movement, a TIA arm deficit strikes out of nowhere. It hits peak intensity within seconds, may be accompanied by sudden numbness, and completely disappears within minutes to hours. No musculoskeletal issue on Earth behaves with this rapid, transient timeline. Sign 3. Sudden confusion and transient memory amnesia. This is the primary sign that almost everyone ignores. It is frequently missed because it lacks the obvious physical markers of paralysis and carries a wide array of alternative excuses. A senior might suddenly wake up in a state of utter bewilderment, entirely unaware of where they are or what they've been doing. They may begin asking the exact same question every 2 minutes, completely unable to retain the answer you just gave them, or exhibit completely uncharacteristic behaviors, having absolutely no memory of the episode after it passes. The hidden trap. In clinical terms, an episode where a person temporarily loses the ability to form new memories while remaining fully conscious is often recognized as a pattern resembling transient global amnesia. Because public awareness surrounding these non-focal cognitive signs is incredibly low, it causes massive delays in seeking emergency care. Families usually mistake it for dehydration, stress, or a bad reaction to medication. When the senior suddenly snaps back to their normal mental baseline, the family feels a sense of relief and drops the issue. But that temporary return to normal is actually the final warning sign before a permanent stroke occurs. If an elderly family member, particularly a woman, experiences a sudden onset of repetitive questioning, a blank memory gap for the event, and a distinct period of disorientation, you must go to the emergency room immediately. Clearly state to the medical staff that you are concerned about a TIA, as this framing ensures the patient is placed on the correct urgent vascular diagnostic pathway rather than being dismissed. Sign 2. Sudden loss of balance, coordination, or unexplained falls. This involves an abrupt, terrifying inability to walk straight, an involuntary veering toward one side, severe clumsiness in the legs, or a violent spinning sensation, vertigo, that makes standing completely impossible. In its most severe form, it causes a drop attack, where a person's lower limbs suddenly buckle, sending them straight to the ground without any tripping hazard and without losing consciousness. The mechanism. The structures at the back of the brain responsible for balance and smooth movement, the cerebellum and the brainstem, are fed by the vertebrobasilar circulation system. A TIA in this posterior circulation zone directly shuts down coordination. How to tell the difference? To distinguish this from common inner ear vertigo, ask, did a movement trigger it? Positional vertigo is consistently set off by tilting the head or rolling over in bed. A posterior circulation TIA strike occurs completely unprovoked by head movement and is frequently accompanied by subtle red flags like brief double vision, difficulty swallowing, or slurred words. Never assume a sudden fall or drop attack in a senior is just old age or a simple trip. If it happens out of nowhere, it demands an immediate vascular workup. Sign 1, a sudden explosive thunderclap headache. This is not a typical tension headache or a standard migraine. This is an abrupt, excruciating headache that reaches its absolute peak intensity within less than 60 seconds of starting. Seniors frequently describe it as a sudden explosion or a literal thunderclap inside the skull, unlike anything they have ever felt in their entire life. The emergency. A true thunderclap headache requires immediate brain imaging to rule out a catastrophic subarachnoid hemorrhage, an active bleeding emergency caused by a ruptured aneurysm. Every passing minute without surgical intervention carries a severe risk of permanent brain damage or death. If a sudden, severe headache is accompanied by any other sign on this list, even a fleeting moment of double vision, a brief spell of confusion, or temporary hand numbness, it indicates a massive neurological event affecting multiple vascular pathways at once. Call 911 immediately. Conclusion. Claim your 80% protection. The traditional F.A.S.T guidelines are excellent for spotting facial droops, arm weakness, and speech barriers, signs 5, 4, and 6. But they completely leave out sudden one-sided blindness, acute confusion, loss of balance, and thunderclap headaches. Clinical data proves that the rapid, proactive initiation of secondary stroke prevention right after a TIA can cut the risk of a future permanent stroke by a staggering 80%. This massive 80% reduction in risk, which protects your independence, your mobility, and your life, belongs to those who refuse to wait and see. Share this guide with anyone caring for an elderly relative. Watch the next video on the screen to keep mastering your health, and I'll see you there. Stay strong, stay independent.